In the last report from Berlin, from ESMO, a couple of sort of very high highlights. I mean by that presidential highlights. I mean the presidents themselves. Lex Egermont, the president of ECCO, has highlighted a really interesting development in the molecular genetic pathways within melanoma. He's a melanoma specialist, and he was on record as saying this is the most exciting time in 30 years of his own melanoma research, because suddenly we've got meaningful targets. He cited the anti-CTLA4 antibody to ipilimumab, where there's been clear evidence of anti-melanoma activity, better than we've achieved with vaccines in the past and with other cellular approaches, and also better than the cytokines. And he's looking forward now to putting those failed therapies back together again, for instance, vaccines plus ipilimumab, and advancing the melanoma results even further. He was also excited to hear the follow-up of the ESCCO paper on the BRAF mutation. There's a particular one which I think is called VE600, and the drug is known by PLX4032 or something. The phase 1 study was reported in ASCO and melanoma, and there were responses in this drug, which has been designed specifically to target this subset of BRAF. And the ESMO meeting enjoyed the follow-up. They broadened out the phase 1 with 33 more patients with this specific kind of melanoma. And it looks like about half of them, that's 50%, this is unheard of for melanoma, are going into remission. So that's really good news. A bit of downside on the PLX story, and that is that to everyone's astonishment, there seems to be 1 or 2 patients who've actually developed squamous carcinoma of the skin under treatment. So there's a long way to go yet, but the first step is really positive. Then the other interesting thing is that we have in the radiation oncology section the next president of ECCO. That's Michael Baumann from Germany, and his group with Dirk de Rauscher was showing the advances they've made in collecting together tissues, that's fibroblasts and plasma and lymphocytes, from transatlantic collaboration funded by the European Commission called GENEPI, G-E-N-E-P-I. And these patients from whom they've gathered this biological material have got super sensitive reactions to radiotherapy. That means that when they've had radiotherapy to somewhere in the body, the normal tissue has overreacted and caused immense problems. Now, this, of course, has been a fear of radiation therapists since radiotherapy first was developed in the Marie Curie days. The limiting factor has been normal tissue sensitivity, and all the imaging related and assisted radiotherapy has been designed to get round this problem. This is the first time that collections of materials have been put together and subjected to radiation in the lab to prove whether this is really the case or not, whether you can mimic the situation. And it looks as if you can. It looks as if we've now got reliable biological models which we can then use to take apart and find out what the genetic pathways are in individual people who show this idiosyncratic response to radiation. So that's one president and one next president. And then the third president is the president of ESMO, and that's Jose Baselga. He's not just president of ESMO, which he does for nothing, as does Egermont and Baumann. They have day jobs as well, and Baselga runs a very exciting and very productive translational science group in Barcelona, and he has presented from his own group a very interesting, looks to me like a randomized phase 2 trial. It's sorafenib plus capecitabine versus capecitabine in advanced breast cancer, and he's shown an effect of sorafenib. So this is the first ever effect of sorafenib as an anti-breast cancer agent. All in all, leadership in the science lab and in the research trials lab from the head of these organizations, and leadership in all the other aspects that brought this terrific meeting to a climax. So congratulations to them, and we look forward very much to the next meeting in 2 years' time.